Well, thank you, everybody. So I'm Bibb Allen. I'm the current chair of the Board of Chancellors, and thank you so much for the opportunity to serve as your board chair this past year. Try this one. Maybe I don't have to do them both together, huh? All right, so anyway, thank you so much. You know, it's just a real privilege to give this report. Who couldn't be inspired now about our future, about why we're here after hearing those two great speeches in the opening session? And throughout the meeting, you'll hear more and more about the distinctive value of your membership in the college and the unique things that the college is doing on our behalf. But this morning, I want to share a little bit about what the board has been doing in conjunction with the steering committee as we prepare the profession for the future. Although our profession has been around only 120 years or so, we rest certainly on a firm foundation, and over the years we have accomplished a lot. Mainly, we've improved diagnosis, and whether it's ultrasound or computed tomography or magnetic resonance imaging, the evidence tells me that radiologists matter. For instance, prior to CT and evaluating acute abdomen, there was a 20% negative expiration rate for appendicitis. Now it's under 2%. So my back of the napkin math works out to this. Radiologists eliminate 65,000 false negative exploratory laparotomies each year in the United States. Radiologists matter to this young woman, and we matter to her physician. Now, socioeconomic research in radiology also shows that radiologists also impact hospital stays, so that patients imaged earlier in their hospital stay have improved outcomes and improved length of stay. Now, we can do some more math there, and when you look at the number of hospital days saved per admission when image is used early, and you multiply that by the number of hospital discharges in the Medicare program, well, that's 4.5 million fewer hospital days in Medicare alone. This is mattering to our patients, it matters to their family, and it matters to the healthcare systems. And finally, of course, radiologists keep families together. We're able to detect killer diseases when they have a chance to be cured. We know that when we follow the scientific evidence, use best practices, and provide consistent and actionable reports, that screening for certain cancers saves lives. And radiologists can save 40,000 lives a year just for breast and lung cancer screening. Radiologists matter to these families. So whether it's fewer operations, whether it's minimally invasive therapy, better outcomes, more birthdays for our patients, it's why we do what we do, and quite frankly, why I love radiology. And it's the job of your board and steering committee to marshal the college resources to empower radiologists to keep doing our best. We want to be your partner for the future. And we also know that that's what you want us to do. We want the college to help all of us take the best possible care of our patients and demonstrate our value to the healthcare system. So much of the board's focus this past year was developing the strategic plan and using the plan to reassess all of the college programs to make sure we keep our eye on the ball. The strategic planning committee included representatives from all across our diverse college, and we especially wanted to make sure that we included participation by younger physicians to hear what they were saying. We did a lot of research, particularly with the council. You were the most important vehicle for our research. And we learned that many view the ACR as a career partner, and the committee took that to heart. As we expected, the most important roles for the college continue to be advocacy, economics, quality. But many of you indicated a need to focus on the future and help us navigate the practices of health reform. And finally, we heard loud and clear that radiologists and radiology organizations need to work together because we're not in this alone. So collaboration, sending a unified message to help align external significant incentives is crucial to what we do. So Paul told you a little bit about the strategic plan. Our core values of leadership, integrity, quality, and innovation came to produce our new core purpose to serve patients and society by empowering members to advance the practice, science, and professions of radiological care. And our new vision statement, ACR members are universally acknowledged as leaders in the delivery and advancement of quality health care, emphasizes the importance of each and every one of our members. Our core purpose and vision statement focus on the members, creating value for members by empowering them to create their own value for their health systems and, most importantly, for their patients. So in the strategic plan, our first goal was around healthcare payment policies and practice models. And it has objectives designed to minimize payment reductions, to maintain radiology's relative value in the fee-for-service system, as well as to help members adapt to the challenges of health reform and assure that new payment models recognize our value to the healthcare system. Another goal centers on radiology and radiology care and patient-centered care. Our objectives here are to position members as stewards of all of their patients' radiological care. They foster widespread understanding of radiologists' value in integrated care teams and the value of the ACR's leadership role in radiology quality and safety. Innovation is what prepares us for the future. Our objectives for the college support taking new innovations like lung cancer screening from science to clinical practice and then to payment policy to assure these life-saving technologies are available to our patients. Our objectives also include promoting health policy research to best achieve radiologic practice, and then the development of innovative IT tools to best integrate the practices into our daily workflow. Our plan for promoting external relations calls for increasing coordination and collaboration amongst radiology organizations and working with external groups, including patient advocacy groups, to understand the importance of radiology by all of the stakeholders that are out there. Our goals in membership are quite simple. They are to maximize the benefits of being a member relative to its cost, because we want to continue to enhance the value of ACR membership, and we especially want to make room for residents, fellows, and young physicians to become engaged in the college. Of course, there are always more opportunities than resources. Our last goal of financial sustainability is about aligning the resources of the college to the strategic plan to make sure that we are using our volunteer, our staff, our financial resources wisely and on behalf of our members. So I want to take the rest of my time here to look at some specific examples of the strategic plan in action as we address the critical issues facing our specialty, whether it's declining reimbursement, commoditization and loss of relevance, adapting to health reform, or attracting the next generation of physicians to radiology. All of these issues are interrelated in the strategic plan. But let's start with advocacy, because policymakers have come a long way too. Now, Geraldine McGinty and Zeke Silva will tell you that I'm the guy in the back there by the American flag. They think I've been doing this so long. Not quite, okay. Steve Ferrara will tell you that he goes back and will find this in the original 1965 Act, that nothing in this title shall be construed to authorize any federal officer or employee to exercise any supervision or control over the practice of medicine. Well, we all know how that turned out, right? And so 45 years later, with the Affordable Care Act, promised sweeping changes in the way medical care is paid for in the United States. And it was Don Berwick's triple aim for health care reform that was the impetus of that, and it was built around moving payments from a volume-driven transactional system to one where health care is rewarded, or payments are rewarded on value. And it sounded simple enough, right? Well, maybe not. Because trying to comply with this alphabet soup of programs created by the government and private payers has really made physicians wonder if they still had time for their patients, or wonder if the hoops that we're having to jump through are even the right hoops to promote better care. And still, there was no sustainability in the physician payments. The sustainable growth rate formula that you've all heard about was becoming increasingly unsustainable. Well, the Congress finally got over whatever it was that prevented them from fixing the SGR. And so a month or so ago, perhaps out of the blue, perhaps not, perhaps they just got tired of dealing with it, but with 484 to 45 combining both houses of Congress, a really big change of heart from where we were this time last year when they just passed the facts. They even had a party celebrating it. Bill Thorworth was able to attend on our behalf. And while Congress was busy celebrating, the physicians will have to get to work, because although it fixed the payments in the fee-for-service schedule, it was very notable about trying to move payments away from fee-for-service and to fix what remains to value. Most notable was the merit-based incentive program, or the MIP, that combined PQRS, value-based modifier, and meaningful use into one. It also addressed measures for patient-facing physicians, which to me suggests that we can be involved in developing our own measures that promote best practices. The act dovetails with Secretary Burwell's recent article in the New England Journal of Medicine, where she states that by 2018, 90% of payments will be value-based, and that 50% of payments will be through alternate payment models. So we physicians have a lot of work to do. So now let's bring quality and patient-centered radiological care into the discussion. Because what's really going to define value? If we look what the Patient-Centered Outcomes Research Institute is funding, we may get a glimpse about that, because it's all about demonstrating better care and improving patient outcomes. Our strategy, which is basically aligned with our Imaging 3.0 initiative, is to develop practical, relevant metrics for radiology, use our IT expertise to integrate them into our workflow, whether it's our PACS, our EHR, or dictation systems, and then to use our advocacy expertise to promote the incentives for widespread adoption. So, for example, our data registries, which include things like the Dose Index Registry, have become qualified clinical data registries for the CMS system. So that means that PQRS now can be reported through that. So again, aligning incentives. Well, radiology is in the information business, and it's for providing information to our referring physicians, whether it's through decision support like ACR Select. It's also about, for us, whether it's providing information about dose, decision support for radiologists, or actionable reporting. And these are the types of things that we all want to be integrated into our daily workflow. The Neiman Policy Institute already has been a tremendous help for us. It was a big investment for the college, but in just a few years, it's paying big dividends as we tackle the issues facing our specialty. Recent publications from the Neiman HPI have quantified the large percentage of radiology services being performed by non-radiologists. And while this will help us in our negotiating our capitation contracts, it goes much further. John Flug gave this abstract at the American Rick and Ray Society meeting last month, showing that while radiologists have made great strides in adopting best practices for adopting double scans, like a chest without and with contrast, that abdomen without and with contrast, non-radiologists have not. As you can see, no matter what setting radiologists practice in, we do better than non-radiologists. And this will be extremely important to our advocacy and quality teams as we look for potential metrics and as we lobby in Washington. Neiman resources like the Data Almanac, the Data Vault, and the inpatient imaging apps also will help us prepare for new payment models. The strategic plan also focuses on the next generation of radiologists, because they are the future of radiology. These young men and women are digital natives, and our research has shown that they are driven to make a difference. They truly want to make a difference. They truly value working in part of teams, and it's part of our job to show them how radiology fits the bill for the future. So I want to focus on team-based integrated care, because that's always been a feature of health reform and is something that really comes naturally to our young physicians. Not surprising. They've been on teams all of their lives, and when they get into their jobs, they also want to be part of teams. Unfortunately, radiologists aren't always considered as part of teams. And so as I sit here being of the older generation with my gray hair, I think, how am I going to think up stuff that's going to make people think that we're part of teams? Well, I don't have to. We'll just ask them. So meet Mark Mangano. I think Mark's here today. He presented this abstract at the Roentgen Ray Society showing how radiologists can work with primary care physicians and improve outcomes and wellness for their patients. So here's Mark meeting with a patient referred from the primary care clinic, showing her how her emphysema and atherosclerosis are affecting her on the inside. It's a team-based approach to improving wellness and outcomes. It's an Imaging 3.0 initiative through and through, and it's part of our case study collection on the Imaging 3 website, and just what the doctor ordered to promote and provide improved coordinated care for patients, demonstrating the value of radiology and radiologists. Another focus of our strategic plan is on building external relationships to foster a shared vision of medicine. We have to look at relationships across the board. Now, you'll hear a lot more about the United States Preventative Services Task Force new draft recommendations for mammography screening. Pretty negative. And we could get in there, and if we have to, we'll fight this fight by ourselves. But wouldn't it be better to build a coalition of organizations to tackle this project together so that we can work in a way that builds a coalition that protects women's access to breast cancer screening on our patients' terms, not those of the United States Preventative Services Task Force. And finally, building stronger relationships within our radiology organizations is also important so we can deliver a unified message outside of radiology. All agree with the synergy between the RSNA's Radiology Cares Initiative and our Imaging 3.0 initiative. So as we continue to refine Imaging 3.0, we will have a great partner in the RSNA that'll help us keep the patients in the center. And it's through this dedication of the volunteers and staff of the college positioned to be your partner in whatever the future may hold. The ACR strategic plan is working for you to help improve diagnosis, improve patient outcomes, to keep patients together longer. It's why we do what we do. It's why we're radiologists. Thank you for being here. Have a great meeting, and this is why I love radiology. So thank you very much.